So good evening, everybody. Welcome to tonight's Health Scrutiny panel meeting. I'm sure everybody knows, but I'm Councillor Daniel Crawford. I have the privilege of chairing this panel for this year. We have a fairly tight agenda, so I'd like to get moving. I don't have any apologies for absence from any colleagues tonight. Does anybody have any apologies to give me now? No, in which case, I'm not aware of any urgent matters. Nothing's been brought to my attention. Everything that's in the agenda paper is public, so we can speak freely about all of these matters, and indeed, I would expect you to do so. Declarations of interest, there are normally a few. Pietra normally needs to declare something, and Alan's already got his hand up. Excellent. Let's go to Alan first, shall we?
Yeah, a member of Health Watch.
Thank you, Alan.
Item later on.
Yeah, of course. Yeah. Pietra.
I'm here on behalf of Ealing Community Network, but I am General Manager of Ealing Community Transport, which has various commercial links with the council.
But I don't think they're prejudicial or anything like that, so you're very welcome. Does anybody else have anything they need to declare? I think we know that Matthew is a member of Health Watch by virtue of why he's here, so I don't think we need to declare that in advance of his report. I'm not aware that there are any matters to be considered in private. As I say, I haven't been notified of any, so I'm just going to proceed with the business that is in front of us. The first of which is to ask everybody to approve the minutes of the meeting on the 9th of June. These are on the green pages if you're lucky enough to have a printed copy, or right at the front of the agenda pack. Can I ask first if anyone's got any questions or queries or corrections to the minutes? And there being none, I'm sorry, it's not letting me see everybody. I'm gonna, yeah, there being no indications, can I ask that we accept those minutes as a true and correct record, please? And I'll take your total silence as agreement with that, which is excellent. Thank you. Please tell me if I'm wrong about that. Right, so our first item is what's billed as a verbal update on COVID-19 in Ealing, but Anna and Neha are going to talk us through some slides. Who's going to go first?
Chair, I'll go first if that's okay.
Yeah, absolutely, go ahead.
Thank you, and then Neha can come in on the vaccination update. My video is not being happy, so apologies if I keep coming in and out, but do let me know if it freezes. So just wanted just to say good evening to everybody first of all. So for those that I've not met, I'm Anna Bryden, Director of Public Health at Ealing Council. So I'm just going to turn my video off if that's okay while I do the presentation, then can turn it on for any questions. So just wanted to give the usual update around the COVID situation for the panel, run through what's happening nationally, locally, updates on testing and contact tracing, very briefly on vaccinations, although Neha is going to do more around that, and then just the key messages to leave with the panel. Is that okay, Chair, and you can still hear me?
Yeah, everything's fine, keep going.
It's entirely frozen in front of me, so I'm hoping it's all fine.
No, you're good. Carry on.
Thank you, Chair. So I just wanted to show you these diagrams in terms of the current situation nationally. It's feeling very mixed at the moment. So rates generally are stable-ish on the whole, but aren't low. They've been relatively stable across the summer, apart from some regions outside of London. So especially southwest England, although it's showing as blue on the map on the left. So not as high as the purple rates. They've definitely had some rates that are higher associated with summer holidays recently, and Scotland particularly seeing some high rates. The schools did go back earlier than in England, although not sure that's a direct link. Just looking, I don't know if you can see the small charts at the bottom. The people testing positive has been stable-ish for the last month or so, but is starting to creep up nationally. The same with the death rate, although it's nowhere near what it was in, say, January, February, and we are starting to see a little bit of an increase there. Similarly with hospital admissions, although that's very variable across the country. So in terms of Ealing, we've been at a rate of around 300 per 100,000 for about a month now, which translates into about 1,000 of our Ealing residents testing positive every week. We have slowed down with a slight we've been decreasing recently very slightly, but that's slowed down. So we now are at the top end of London again, but there isn't that much variation. We've talked before here about why that might be the case in terms of a number of risk factors linked to deprivation, ethnicity, etc. We have seen a very small number of COVID deaths, very sadly, in the last week of data that we have. Like I said, with the national picture, similarly, there's been a very, very slight increase in recent weeks. So we've had 21 COVID-related deaths in the last month, but we are seeing those numbers as much lower than they were earlier in the year. Now, just wanted to update about testing. The testing that's available for residents of Ealing with symptoms of COVID are the same as they have been for the last few months. So there's different opportunities available within the borough, other boroughs, and also home testing kits. The bit that's been changing, especially since we last reported here to the panel, is for people without symptoms. So we are encouraging people still to get tested twice a week with those rapid test kits. We've got different options available. If people want support with how to do the test, they can go to one of 17 pharmacies, and those details are on our website. If they just want to do their home test kits, they know what they're doing, want to do them at home, and that might be easier for them. Most pharmacies in the borough stock those, and you can just go and ask for those for free. And also recently, 10 of our libraries across the borough are also have availability of those home testing kits. We've been taking more of a targeted approach over the summer with really, really good local engagement with community groups. So that's both around testing, but also vaccination messages and key COVID safe messages. So we've been doing really good links with organisations like Ealing Food Bank, Rise Women, Women's Refuge. And we've also been linking up some faith settings with local pharmacies. So the pharmacies have been working with those faith groups to carry out assisted testing. And that's been at places like the West London Islamic Centre and one of the big Gurdwaras in Southall. So that's been doing assisted testing and handing out kits. And we're getting good feedback from those settings. And we've also been distributing kits and information at different vaccination pop-up events over the summer. So over the summer months, we did distribute over 14,000 boxes of kits to local residents. Just moving on to contact tracing. Some of this gets a bit technical, apologies, I won't go through it all, but I think it's important to know that over earlier in the summer, we were doing what's called local zero, which means that our local team were calling all cases testing positive in Ealing. None of them were going through the national team. We were doing really well with that and meeting all the targets, had a success rate of around 90%, which is great. Over summer, as we got more cases nationally and including in Ealing, the NHS took some of those back. So they introduced where they essentially started calling cases for that first 24 hours before passing on the more difficult ones to Ealing. Who then managed to follow up about 50% of those remaining cases. We are hoping to increase the number of cases that we call from a local team and potentially trying that out in different parts of the borough. Luckily, we have been able to recruit some additional volunteer staff, so really increasing that 7-day capacity and being able to scale up, especially as we move into the autumn. We've also been doing a little bit of door knocking over the spring and summer for cases that can't be reached. And we are exploring options for continuing that, for at least for the most vulnerable residents or those that we might have most concerns about. And very brief vaccinations, I know Neha is going to cover this in more detail, but just overall pictures, we have seen more than almost 250,000 first doses and 230,000 second doses. Which means that about 64% 84% of people, adults, have had their first dose, and over half have had both doses. We're seeing the same patterns as we have been over the last few months in terms of uptake and inequalities. So the more deprived areas, and especially younger men and people from different ethnic groups, for example, traveller communities, white and black mixed ethnic groups, and Arab ethnic groups, we are seeing lower uptake of the vaccine. Have been doing a range of work to try and support vaccine confidence in those groups, and really through a lot of communications and engagement. Just wanted to mention here again, having the second vaccine is really important, especially for the Delta variant. That's the variant that was first identified in India back in the spring. Now accounts for pretty much all COVID cases in the UK. Luckily, the vaccines are still very, very effective against this variant, but there is more added value from having the second vaccine for the Delta variant, so it's something we're really trying to encourage. And some wards of South particularly have got a bit of low uptake for that second dose, even though the first dose is quite high. So even this week we just had a small last week. Just trying to show we'll do.
I think we might be losing you just a touch.
We could just that.
It's quite difficult at the moment.
Carrying on with partners to me weekly, and that's going to take social engagement communications. Importantly, to
this is too much disturbance.
Yeah, thank you, Councillor Miller. It's really difficult to hear Anna at the moment. I don't know what we can do about that, but I think we've got the gist of the vaccination part. I wonder if we could ask Neha to come in with her part of the vaccinations, and then we can try Anna again in a little bit. Is that possible?
Yes, thank you. I will share my screen if that's okay.
Right.
I'm hoping you can see my screen and you can hear me properly.
Yes, we can. Go ahead. Yeah.
Fabulous. Okay, so just as Anna was saying, our total vaccination rates, we have now given first dose to 65%. This was a few days ago, 66% close to, and a second dose to close to 57% of our population, of adult population in Ealing. And this was as of 5th of September. As you will know, there has been a lot of activity over the weekend around the vaccination plan. So what I wanted to just give you an update of was the plan for the next few months from an Ealing perspective. I won't be able to give too much detail because we are still waiting for a lot of the information. And Dr. Vijay Taylor also should be on the call and can answer any clinical questions if needed. So the first one is around the booster vaccine, booster campaign. As you will know, that the health services have been asked to plan to deliver the booster vaccine. And we've been waiting for the confirmation to go ahead with the booster program. And over the summer, we've been through a lot of work working with our GP practices and other providers and pharmacy providers in particular to establish how we will deliver the booster program from September onwards. We've agreed 3 sites. So the Dominion Centre in Southall, which is well known by everybody, which will be run for the Southall patients in particular, with our Ealing GP Federation supporting them very closely. Grand Union Village, which is a health centre, will have a GP-led clinic run there as well. Mattock Lane Pharmacy is actually working in collaboration with some of our GP practices in the east side of the borough, and they'll be running from St John's Church, which again is another site that's been running for quite some time now. So those 3 sites will be running quite extensively and running most of the vaccine booster program as and when we get the go ahead. But they will also be starting to deliver the evergreen offer, which is the offer of, if people haven't taken up the first dose or the second dose, to come and have that dose. They're planning to deliver around quite a significant number of vaccines, but also we have one of our GP networks has worked really closely with Roxanne's Pharmacy in Greenford, and we're hoping that their site will be assured to run out of Greenford Methodist Church as well. So hopefully that will be a fourth site. And in addition, we've worked with a number of pharmacies, and we've got the most number of pharmacies that have been put forward to NHS England to provide vaccination, but we are waiting for the assurance process to complete to then confirm those sites, but hopefully they'll be dotted all around Ealing. I talked about the evergreen offer, and patients can already book their vaccine. So if anybody wants to take up the offer of a vaccine first or second dose, they can go on the national booking system and book their vaccine dose. There is also a website called Grab a Jab, or I can't remember the exact name of the website, but if you type in Grab a Jab in your search engine, there is a site which takes you to a list of all of the walk-in clinics where you can get a vaccine on that day. And then if you put in your postcode, it tells you where your closest clinic is. And we're keeping that regularly updated. In addition, we've worked really closely with our local authority colleagues and the care homes, and our vaccination take-up rate has been really impressive. In fact, I saw some figures, and the staff vaccinated rate is now up to 91%, which I saw today, which is really great. And we've got a specific task and finish group working between our community services provider, who provides a lot of the healthcare provision into the care homes, our local authority colleagues and the care homes, and ourselves, to ensure that we're doing everything we can to support and encourage the staff to take up the vaccine. But we have done really, the staff really have taken up the vaccine. So it's a really good news story, but there's still some more to do. 12 to 15-year-olds, as you will know, as of the 3rd of September, and I think as of today, unless I've missed the news, the JCVI still has not approved a universal offer for 12 to 15-year-olds, and it's with the chief medical officers to make the decision about the next steps. We are in at Northwest London level. There has been a working group already set up, putting plans together about how we will ensure that we can vaccinate all of the children in the schools by potentially going into the schools to run the vaccine program. So as and when that happens, we will share the information if that's what the direction of travel is. For the vulnerable 12 to 15-year-old cohorts, as you will know, we have already got the green light to vaccinate these children. We ran 3 clinics over the last 2 weeks at the Dominion Centre in Southall, supported by the CNWL childhood immunisation teams, and we vaccinated 150 of the most vulnerable children. There are still more to do, and we're just preparing plans about how we go into those special schools to vaccinate those remaining children and those that aren't in special schools as well. We already vaccinated a few of the 16 to 17-year-olds at some of the special schools earlier on in the year. In addition, for the 16 to 17-year-olds, anyone that is 16 to 17-year-olds is at the moment being encouraged to take 1 dose unless they are 17 years and 9 months, at which they can get both doses. The national booking system allows anyone that is 17 years and 9 months to book an appointment through there. If they're younger, between 16 and 17 years and 9 months, they should go on the Grab a Jab website, which I spoke about earlier, to get their 1 dose. And finally, around the immunosuppressed cohort. So you will have seen in the press the description of the immunosuppressed, a cohort of patients who are severely immunosuppressed when they had their first or second dose, to get a 3rd dose. It's not a booster dose, it's a 3rd dose. It's an extra top-up dose to generate a full immune response. And our primary care colleagues, we met with them today, and we're just working with them to ensure that they know where to send these patients and advise them where to go. And this slide here just gives you a bit of a, so although our overall take-up rate is around 65%, you can see some of the most vulnerable patients is a lot higher, which is really good. And those that take up the first dose usually take up, primarily do take up the second dose. So that message about ensuring that they're taking the second dose of it is really important. I'm going to stop sharing my slides. Thank you.
Thank you, Neha. I think we would all like to pay tribute to everyone who's still involved in the vaccine rollout and making sure that everyone gets their vaccine, because it's a really significant undertaking and it seems to be going very well. And to that point, Kerry put some additional care home data, because it's been a topic of discussion here previously, in the chat. So I'll just read it out for everybody who isn't accessing the chat or hasn't seen that yet. So he says the updated care home data for staff is 93% have had their first dose and 86% have had their second dose. This is an improvement from the previous week's data, where it was 89 and 77% respectively. So, you know, I know colleagues had voiced their concerns about care home staff and the low vaccination rates previously in our last meeting. So we are getting there to a much greater degree on that. What I'm going to try and do now is see if we can go back to Anna for those key messages, and hopefully we'll be able to hear Anna because she's on a different device now. Let's try it.
Yeah, can you hear me, Chair?
Much better, Anna. Yeah, thank you.
Sorry, I was informed by Kerry I dropped out quite early on, so I was happily chatting to myself there. Apologies. If you're happy, I'll just verbally do a few key messages. I understand you heard the national picture and then disappeared afterwards. Is that right?
We got quite a way through the last bit before the key messages, but because it was on the screen, we could ascertain what was necessary to bring in, but we couldn't hear much of you at that point. So I think just the key messages for now would be great.
All right, thank you. So just 3 sets of key messages from us, and these are what our communications and our community engagement team are using, and great if panel members can share these more. So schools obviously have gone back with quite different set of guidance, so still being encouraged around things like ventilation, but there aren't things like school bubbles, distancing guidance has changed. So key messages around schools are that if any pupils come into contact with someone at school who tests positive, they no longer have to isolate, but will be asked to take a PCR test as soon as possible and reduce their social contact outside of schools as much as possible until they get those results. And pupils are being offered 2 tests at schools as they go back, and then are being asked to do twice weekly testing at home from them for the rest of September. Next set of key messages is around what Nay had touched on, that vaccinations are available for 12 to 15 years if they have underlying conditions, and 16, 17-year-olds universally. So really encouraging those cohorts to take up the vaccine. And finally, really encouraging people to get their second jab. It's the best way of staying safe against COVID. So 8 weeks after your first jab, you're eligible. Don't need to wait to be contacted. Just walk up to a vaccine clinic and get your second dose. Thank you, Chair.
Thank you, Anna. Right, I'm going to open it to questions from colleagues, and VJ has indicated. Dr. Taylor, good evening.
Unmute myself. Hi, evening, everyone. I just want to add just an extra little dimension on the vaccination service. The other area is what we've also agreed that in London, particularly around the university students, we are going to have 2 vaccination sites, one at Imperial and one at King's College, which all the London University students will have access to, so that they can have their second or their first or their second COVID vaccination. And there are going to be some fixed dates for that. So that will also include Brunel University, obviously as part of University of London. So all the universities in London are taking part in that.
Okay, thank you, Dr. Taylor. Can I go to Councillor Conti, please?
Thank you, Daniel. So I just had a couple of questions, that's all right, for Anna. And it was mainly on testing. One of them was on, I think mentioned in one of the slides, there was 18,000 lateral flow tests were distributed. I wonder how many are actually were used. I don't know if that information is available in terms of the actual usage of the tests that are being distributed, and in terms of how successful the campaign of distributing them has been. And then in terms of contact tracing, because I know obviously I think it was in mid-August, the rules changed regarding double vaccinated individuals not having to isolate if they've been in contact, but recommending a PCR test. But I don't think it's in England, it's not mandated. I was just wondering, do we know the percentage of people that actually then who are contacted then go on to have a PCR test, or do the majority of people don't take up that offer? I was interested in knowing a bit more about
that. Anna, do you want to?
Thank you. Yeah, thank you, Chair. Thanks, Councillor Conti. So both really good questions. Testing, unfortunately, the data doesn't allow us to trace our tests. So when we give them out, we can't see if they're used. What we can see is overall how many people are getting tested, Ealing residents, either with the rapid test kits or with PCRs. However, it's really, really hard to see where they're from. If they're tied to a school, for example, or a specific workplace, sometimes we can trace that back. But everything else is under one category that's grouped up that includes home testing kits that you get online. So unfortunately, it's not traced. We are having a bit of a think internally about how we might be able to try and ascertain that, even if it's through surveys or feedback at events. One thing we are trying to do is not just give out tests, but offer that assisted testing. And that's where we've been really, really pleased with the engagement we've had with those faith settings. So people, especially if they speak different languages, might access information through lots of different routes, see the faith settings as a trusted setting. So that they can actually be shown how to use the tests, how to record the results, etc., so that they can then use home testing kits and take that forward. But agree, it isn't an ideal situation, doing what we can to kind of make that as meaningful as possible. In terms of contact tracing, again, we don't have the data. Shows how many people have actually gone on to take PCR tests. We do know that the testing, the number of PCR tests are relatively high at the moment generally. And we are starting to see that increase a little bit. What we have heard from the contact tracing team is that people are a little bit confused generally about that guidance, but actually when they have the conversations, they're generally quite happy with that advice. Whether they actually go on to have a PCR test is another point, but on the whole, we're seeing that people are generally okay once they've got the advice. Thank you, Chair.
Okay, thank you. Sorry, I muted myself. Right, Piotr and then Alan, and then I'll ask again if anyone has got any more they'd like to say.
Okay, thank you, Chair. First of all, I'm absolutely flabbergasted and impressed at the improvement in the figures for care homes, which, as you say, was causing some concern. I think that's absolutely brilliant. Two questions very quickly. One, I know that the community engagement team, and you talked about, Anna, you talked about getting in touch with local groups to do testing. Now, I'm sure, they can get in touch with many, but there will still be small unregistered or community groups that we might be able to get hold of perhaps at ECN. And the question is, where do they contact, who do they contact to get to be able to assist in the testing program? So that's the first question. And the second question is probably a very easy one. Can people turn up at these 4 evergreen sites without just walk in, basically? If you could just confirm that, I'd be grateful.
Thank you. I'll try and answer the first question. So yes, absolutely. I think that link with small community groups is really important. We commissioned quite early on in the pandemic a group called Each Counselling and Support that are doing a lot of that kind of grassroots engagement with very small community groups. So if some of the groups you're aware of aren't linked up with that, maybe let me know, because I think that's a really important link in terms of that. if somebody interested in being linked up in terms of the testing, so for example, handing out kits or doing some assisted testing, the email address on the last slide is probably the best one. So it's publichealth@ealing.gov.uk, and we can take that forward. Thank you. I'll hand over to Neha about the vaccination sites, if that's okay.
Thank you. Yes. So we are in conversation with the provider for the Dominion Centre, and when it's up and running, they should hopefully be running a few clinics where you can just walk in. But actually, we're not limited to those 4 sites for a walk-in site. If people go on that website about finding a vaccine and grab a jab, actually there are a lot more sites, including a lot of pharmacies who may be even closer to residents that the patients may want to go to. So there's a lot more opportunity in terms of walk-ins.
Okay, thank you very much. Alan is next. Alan, are you ready?
I think my question is slightly a tangent, but it is involved in the whole issue, is what are the plans for actually distributing the flu jab through the winter period? When's that going to start? Because we've heard nothing from the CCG, Public Health or anyone. I've already booked mine privately through Boots the Chemist, but there's nothing in the system. And particularly since the government are saying that those of us that are over a certain age who may have a booster will get the flu jab at the same time. And it's a fact that they haven't made their minds up yet, means that we are going to go into that flu season unprotected unless we do something about it.
Can I come in first?
Yeah, go ahead. And then I'll take VJ as well. He'd like to come in, I think.
Yeah, so rest assured, Alan, it is very, very much in hand. I know a lot of patients have already received invitations to come and take their flu vaccination. I know I'm one of them, definitely, being in the high-risk group myself. I do know that all of the practices have started to plan when their flu clinics will be. We have the usual plan that we run as a CCG, and I know our local authority colleagues and public health have a similar plan. We've been working very closely on a joint up group to make sure that we encourage as many people to come and take the vaccine, and we have a good process to invite people to come and have the flu vaccine. And I think it's important to note there was a lot of talk earlier on in the summer around COVID vaccine and flu vaccine happening at the same time. The message is very clear now that, you know, we're not going to wait for one or the other. If the flu is available, we will start with the flu. If the COVID is available, we will start with the COVID. So very, very much in the throes of starting. I know I spoke to a practice today who received their first flu vaccine delivery today. So it's very much starting, and you will be hearing a lot more about it.
Taylor, would you like to come in?
Yeah, I just want to add, in terms of Alan, what you're referring to, as you would have gathered from the press and from the media regarding the logistics of the HGV drivers in terms of delays in the delivery of the flu vaccination, particularly in relation to Sequest, which is the vaccination for our over 65s. There is a delay in general practice, so where practices were expecting to get their flu vaccinations as of this week, there has been a 2 to 3 week delay in that, and so practice is still waiting for a confirmed date when they will get those vaccines, and hence then they can then start to plan their rollout with their individual patients. There isn't any issue with the flu vaccination for children. Those logistics are in place with a different flu vaccination. So practice has already started to plan their 2 and 3 year olds for their flu vaccinations, and that's already started as of this week. But it's what Neha said is absolutely right. Public Health and the Committee for Immunisation have made it quite clear that Flu vaccination should not be delayed just because the COVID vaccination program for the booster has not started, and it's imperative that our population and the high risk population do get their flu vaccination before the flu season starts to kick in the coming months.
Okay, thank you, Vijay and Nehar. The other Councillor Crawford would like to ask a question, so I'm going to turn the screen around. So
I wanted one question.
Okay.
Can I ask the question now?
In a minute, Councillor Midden.
All right. Okay.
Take first and then I'll come to you. Okay.
Hello, everybody. I'm still interested. I mentioned it in a previous meeting in addressing the very hard to reach groups, particularly in my ward, East Acton, and it relates to HMOs. HMOs, the council have all the contact details for every single, or most of the HMOs, and there are many in Ealing. And this is very much a hard to reach group. They're very robustly socially active, and these are the very residents who are going to our stores, supermarkets, shopping. They have no one else to do it, and to me that there are serious issues. Has any progress been made following my question at a previous meeting? Because to me, it doesn't seem too difficult for the selective licensing team to send letters to each HMO. Thank you.
Can I just ask what an HMO is, please?
A house of multiple occupancy.
Thank you.
So, Anna, I don't know if you can give us an update or an answer on that.
Yeah, I can give a high level answer, Councillor Crawford, and then I might need to take it away to talk to other colleagues if that's okay. We have, for the vaccination work, we have had a subgroup running for a couple of months now, which is looking at inclusion health. So that's lots of different hard to reach groups, including homelessness, people who might not be registered with GPs or have documentation, people living in HMOs. And so there's a lot of work being done there with local community group, sector groups, local voluntary groups, and with different teams across the council and the NHS. So that work is looking very much at vaccinations, but hand in hand with other health issues, including, say, COVID testing, self-isolation support, and links with, say, the flu jab. In terms of HMOs specifically, and your suggestion about the council doing direct contact with that, I'll have to take that back and discuss that with the group if that's okay, and then I can share some notes back with the chair. Thank you.
You want to come back very briefly, please?
So, very briefly, it will be. Could you please come back at the next meeting? Because I think it's quite a serious issue, and this community, the residents who live in HMO community, and they probably don't have a GP. So I would welcome some work being done in this area. Thank you.
Okay, and
Yeah,
Councillor Midden. Sorry, thank you, Anna. Councillor Midden, you wanted to ask a question?
Yeah, thank you, chairs. First of all, I want to say thank you all the officer and the staff. They are working really very hard. My question is that the death rate is too high in Ealing. What's the reason? Because 84% they have both vaccinations, or might be lack of treatment. What's the reason it's a high death rate in Ealing? My question is that. Thank you.
Thank you, Councillor Midden. Anna, would you like to go first?
Yeah, thanks, Councillor Midden. So we're not seeing a particularly high death rate in Ealing. We are seeing the numbers go up very slowly along with everywhere else in the country, as we have had relatively stable but not low rates over the summer. So we have unfortunately seen some more deaths. The vaccinations aren't perfect. They give very, very good protection. against COVID, they're never going to be 100%, and that's the same with all of the vaccinations. So that's expected. In terms of people who are unfortunately ending up in hospital with COVID, we are seeing generally two cohorts. So one is people who are particularly elderly, particularly frail, have other health conditions, who might have had both their vaccines, but have ended up unfortunately with COVID and affecting other health conditions. We are seeing about half of people in hospital are not vaccinated at all, and are usually in the younger age groups without other health conditions. So the kind of 30 to 40-year-olds, less likely to die as a result of COVID, but still obviously nobody wants to end up in intensive care. So it's the same concerns as it's always been with COVID in terms of inequalities. We do see older people, unfortunately, more at risk of going into hospital, and then some unfortunately dying. But I think the vaccination work that we're pushing through is really, really important for this, along with all of the COVID measures about hand washing, distancing, fresh air, etc. But the vaccination is really important, and again, that's why the work in care homes has been really, really important in terms of getting those rates up among staff as well. Thank you.
Thank you very much.
Thank you, Anna. I don't have any more indications. Oh, sorry, Dr. Taylor. Sorry, you wanted to come in?
Yeah, I just want to add a little, just put a little bit of context on what Anna says. So, what we are finding in Northwest London is that 2/3 of the hospital admissions that we are seeing for COVID are people who've either had no or one vaccine. But however, we are seeing 1/3 of the admissions are our population who've had 2 vaccinations. So it's important to appreciate and realise that the COVID vaccination, there's no guarantee it will prevent you from getting COVID. What we do know absolutely that it does reduce the severity of the disease. But like Anna said, there are patients with comorbidities, with complex medical needs who do get COVID, who may have had 2 vaccinations, who still potentially may end up in intensive care, and they may succumb. So that is the reality of this disease.
Thank you very much, Vijay. So I'm going to draw this section to a close, just really to reiterate that point then for all of us in terms of encouraging people to get vaccinated if they haven't been vaccinated already. That's really important. And also to reiterate our thanks to everybody who's involved in this process at the moment of getting people vaccinated, doing the vaccinations, and contacting people about the vaccinations. I've had both of my vaccinations, and it was very smoothly done in Ealing, and I know that's most people's feedback, but we absolutely do need to place on record our thanks to everybody. So if Anna and Neha could take that back to colleagues, we'd be, and Vijay as well, we'd be immensely grateful for that. Right, I'm going to move on to our second substantive item this evening, which is on the quality of registered care services, and that's going to be led by Kerry Stevens, who is with us and is ready.
Thank you, Chair. Would colleagues like me to share screens, or has everybody got the report in front of them?
Oh, that's one where I need some audience participation. What do we think? Some people have got the report. Are we happy to have Kerry? Oh, okay, Kerry, if you talk through the report initially, and if we need to take any more information, we can bring that up on the screen.
Thank you, Chair. So members of the Scrutiny Committee will recall that this was discussed at the last meeting, that we thought it would be useful to share some information with the Scrutiny Committee there in terms of how health and social care provision in the borough for care sector in terms of care homes and registered care provision is rated. The second page gives you some background to the size of the market in Ealing. You'll see that there's 117 registered care providers within the borough. of which 64 are domiciliary care homes, 2 are extra care schemes, which are effectively supported living, 19 care homes, 28 residential homes, and 5 regulated supported living services. Of the care homes within the borough, we've got 1,586 registered beds in the borough. That means we're the 5th highest in London in terms of beds within the borough area, and we've got the highest number of care home beds in northwest London. Of the care home beds which are within Ealing, the council commissions approximately 32% of the beds, with 19% being commissioned by other local authorities, 14% by the NHS, and 11% are funded by individuals directly. There are currently just over 20% voids within the sector, which is obviously a concern in terms of the viability of the sector, and it's something that we're keeping a very close eye on. Within the domiciliary care market, within Ealing, there are just under 4,000 packages of care being provided as of the 1st of July this year. And of these, the council procures 29%. So you can see from the size of the market, we've got a large market within the borough, but within that market, the council has limited leverage, approximately 30% of the capacity across care homes and across the domiciliary care sector. Within the registered care market, the inspectorate is the Care Quality Commission, or people may have heard them referred to as CQC. They have responsibility for regulation of the sector, and the council has limited responsibilities in that sector, although I hold some statutory duties as Director of Adult Social Care in terms of supporting a effective and vibrant market. Within the responsibilities of the regulator CQC, they have an inspection programme where they'll look at 5 key areas in terms of their inspection programme. This is: are services safe? Are they effective? Are they caring? Are they responsive? And are they well led? The outcomes of inspections produce a rating for the regulated service, which are outstanding, good, requires improvement, and inadequate. It's worth noting at this stage that the council took a decision just over 2 years ago that we would only procure domiciliary services from good and outstanding providers for new packages of care. In terms of the current rating of services in Ealing, there's been a hiatus in the inspection programme due to the pandemic, and the inspection ratings show that we're on a downward trend in terms of quality within the sector, and this is something that we're working very closely with the sector to try and support them improve the inspection outcomes. In terms of, I'm now on page 6. In terms of the impact of the pandemic on the sector, there's been lots of investment that's come from both national government of approximately £7 million into Ealing to support the sector through the COVID-19 grants, plus the council has put additional investment of just under £1 million into the sector to support them during very challenging times. The council and its partners have worked very closely during the pandemic. It's been an extraordinarily difficult time. As you're aware, that we've had providers under significant pressure due to financial challenges, due to the void rates, issues with regards to maintaining quality during the challenging times of lockdowns, and the council, NHS and other partners, as well as the sector, the provider sector itself, have worked very closely together to maximise the impact of infection control procedures, and also to reduce the number of risks with people acting as vectors, bringing the infections into the care homes, but also into individuals' own homes through the domiciliary services. So there's some highlights, Chair, in terms of the report, but the report goes into a lot more detail, breaks down the registered care homes within the borough in Appendix 1, and Appendix 2 gives some examples of the registration outcomes and regulatory views. You'll see on slide 13 that the council now has access to information from a new toolkit called the MIT Data Source Overview, which comes from London ADAS, the Association of Directors of Adult Social Care, that's giving us greater detailed information about what's going on within the sector. And there is a chart towards the end which shows how the quality of the sector is being impacted through the pandemic. Is that okay?
Yeah, thank you, Kerry.
Yeah.
I will ask colleagues if they'd like to ask questions. One colleague has already been very persistent, that's Councillor Crawford. You can see her finger there. So I'm going to ask her questions now, and then I'm going to come to the rest of you. Those of you who've got your hands up, can you keep them up for me? Because I'm not very proficient at this sort of thing. Right, Councillor Crawford, you're going to go first.
Yeah, I'm interested in whether there's been through the impact of COVID, the pressures and the voids that a lot of our care homes have had. Have there been any closures? Is that going to, if so, is that on us? And do you know whether there are a lot of what's the term? People, residents still in hospitals waiting to be discharged to go into homes. I imagine now is the time for that work to be done. Thank you.
Thank you, Councillor Crawford. We haven't had any homes closed directly as a result of the pandemic at this stage. The bridging funding that's come from national government has made a difference and provided some liquidity in the sector. So there's the additional 7 million from national government and the additional million from, or just under $1 million from the council has been invested to support the sector. We do think that this is going to be a very challenging period for the next 12 to 24 months as the sector tries to stay on its feet without the additional funding from government, and we'll see what the additional funding that's being discussed in Parliament today does for the sector. One home has closed in Ealing in the last 12 months. That wasn't directly related to the pandemic. That was more related to the status of the building that was occupied by the provider. In terms of the work that's being done for discharges from hospital, the council and its NHS partners have worked very closely to ensure that we maximise flow from people, of people leaving hospitals to return back to care homes. From very early on in northwest London, we've had a hot site for people who had a positive diagnosis that was at the Mary Robinson unit and then moved to a home in Hounslow. So we continue to work very closely with our partners to ensure that people don't stay in hospital for too long.
Okay, thank you, Kerry. Sorry, I'll put myself on mute. Councillor Conti.
Thank you, Councillor Crawford. My question, the other Councillor Crawford sort of asked part of the question, but it was just really on, so just to follow up on that slightly, so what the void rate at the moment is 20, I think it was 24% in the report. What do we, where do we envisage it, like what direction do we see it going? So do we think in 6 months we'll be back at sort of a void rate of 5% or 10%? And what's sustainable for the sector in terms of, as some of those like the bridge funding comes to an end, can they sustain it with a void rate of 10, 15, 20%? Because I think one of the care homes, I think you said it has in the report that has only 3 beds, and obviously if a third of those aren't there, or 1 in 3, that's going to have a huge impact on them. My second question was just on the ones that are rated inadequate. I think it's about 25% of all the providers were rated as inadequate. I was wondering whether there was any common themes that run through why a quarter of them have that rating, and in terms of what work is being done to try and support sort of them improving. Thank you.
Thank you, Councillor Conti. In terms of the viability of the sector, in terms of a financial model, it varies between the homes significantly. Some homes will have a much leaner system, a much leaner model in terms of what is viable for them to be financially stable. Generally, the larger homes will require 90% plus to be in the red in terms of their in the black in terms of their financial position. It does vary a lot. In terms of what the future use of the care home beds is likely to look like, there's lots of different research. London School of Economics was saying recently that they thought the current behaviours would stay in place for 3 to 5 years in terms of people being less likely to use care homes for their loved ones or for themselves. So we're keeping a very close eye on the sector because we think this is going to be a quickly shifting environment, and the market impacts are likely to be quick and something that we need to plan for where possible. Does that answer that question, Councillor Conti?
Yeah, the first one. Was there anything on the second question?
Yeah, so in terms of the quality of the sector, we meet regularly with providers across the piece to offer support and advice and development opportunities where possible. As a percentage, for 25% of care homes in the borough or care providers in the borough to be requires improvement is not something that we're happy with. There's a working group looking at this through the Integrated Care Partnership, which is Ealing Council and NHS and other partners, so that we can develop opportunities to support the market to improve. There's a real balance between not working with organisations that have low quality provision and being quite clear where there's quality concerns that we don't work with them. And then the balance is to support those organisations developing into higher quality provision that we can use. I think the steps that we took as a council to only procure from good and outstanding in domiciliary care has helped drive the market. We've got a relatively dynamic market in Ealing. In terms of care homes, it's more complex because the people are very vulnerable and it'd be difficult for us to move people from providers. That said, it doesn't stop us where there are real quality concerns. We do end our contracts, and we've done that on a number of occasions in the last 24 months where the provision has not met our requirements, and then we've ended our contracts with them and moved the individuals because it was seen as the best outcome for them.
Can I ask a very small supplementary question to that, if that's all right, Chair?
Yeah, go ahead, Jeff.
So is there any relationship between the providers that are requiring improvement and the ones maybe with a greater void? So do we find that the ones that are outstanding, etc., have a smaller void capacity, or is it quite uniform across the system? That was just my last question.
It's an absolutely good question, Councillor Conti, to ask. It does vary significantly. If you're running a medium-sized home with an outstanding rating, you're more likely to get the self-funders and other people procuring services, not necessarily through the council's commissioning routes. There's significant variation in terms of the void rate. So we've got low void rates in some of our larger care homes that may not have such a good rating, but some of the smaller care homes will have high rates of vacancy but rated more highly by CQC. So there is a significant variation across the piece.
Hey, thank you, Councillor Conti. Thank you, Kerry. Right, I've got Alan and then Piotr, and then I'm going to go to Roy Willis, if that's okay. Alan?
Thank you, Chair. What would have been interesting is to actually know the number of beds that were actually allocated to residential care and those that are actually nursing beds, for the simple reason that the cost envelope for nursing must be higher than that for just straightforward residential care. And that would have particularly have been more interesting when we got to the October figures for last year, where we're we're actually looking about what Ealing purchased and other organisations, i.e. other local authorities, the NHS, what they were actually purchasing, because that would give us an idea of what the future might look like. And the other thing that would have been probably better was to actually say that although we claim 32% of the actual beds are used by Ealing in the October figures, it's actually 42%, because we really shouldn't be looking at those beds that are void. We should actually be looking at what the council is purchasing at the time. I think that would be extremely important point to make.
Yeah, I think that's really helpful, and I can certainly get the breakdown for you on residential and nursing home beds as a comparison for you to look at how the market is set up. What we do tend to do from a council perspective is we are looking to be less dependent on residential care and supporting more people to live in supported living arrangements or within their own homes. So you'd expect to see the number of residential beds reducing and the nursing care beds staying static within demography growth and expected increase in demand through that route. But I can pick that up outside of this meeting and maybe bring it back to the next meeting, Alan.
Yeah, thanks, Kerry. Chris has put some information in the chat, which I'll read because not everyone can see the chat. Approximately 2/3 of nursing beds and 1/3 residential care based on the GP care provided by Ealing Community Partners. So I don't know if that helps, but thank you, Chris. I don't know, Chris, did you want to speak to that at all? Sorry, I haven't brought you in today. Would you like to speak to that at all?
Not especially, Chair. Other than to say, of the 1,500 beds that are registered within Ealing, we're moving to a position where Ealing Community Partners and the Argyll Surgery, with whom many of you are familiar, are providing the primary care support, and it's a little over 2/3 are nursing in terms of their registration, and a bit less than 1/3 are designated as residential care.
Thank you, Chris, and sorry for springing that on you there. Piotr, you wanted to come in.
Yeah, just a very, thank you, Chair, very quick question based on the other Councillor Crawford's comments earlier about bed blocking. I don't actually have any figures about bed blocking in Ealing. I know it's been a problem in the past, but I was wondering, with a void rate of 24%, I think we were talking about earlier, whether there is a relationship between those two figures, and if there isn't, then maybe there should be, or what is that relationship, and how do you see that one should affect the other?
Thank you, Piotr. In terms of the void rate is a product of people who have sadly died and died sooner than would have been expected due to the pandemic. We know that people in living care homes have been had significantly greater impacts because of the pandemic than the wider population. And the second impact on the void rate is the concern for individuals and for their families to move into care homes, so that you've got the two issues impacting on the numbers of people within the care home sector currently. In terms of the bed blockers, as they were previously called, or people who have extended stays in hospital, we work very, very closely with the NHS through Chrissy's services, working with NAHAR and colleagues within the CCG, but as well as with the Acute Trust, to ensure that we support safe and timely discharges from hospital. Our performance has been good. Ealing, as a council, one of the only councils in North West London that's had continued 7-day working throughout, well, since the start of the pandemic. In effect, we've remained in winter pressures with response mode. I don't think that there's a direct correlation between extended lengths of stay and the void rates within the sector, because not everybody would necessarily go into a care home on discharge from hospital. Does that answer your questions, Piotr?
Yeah, he's putting his thumbs
Yes, thanks.
up. So but we may want to return to right. I'm going to bring in Roy Willis now from Ealing Reclaim Social Care Action Group. Roy has submitted 3 questions in advance of the meeting that he'd like to ask Kerry, and so I'm going to ask him to do it now.
Hello, thank you. I've got 3 questions on social care generally, and it's very helpful to have the report that Kerry submitted, so that at least one of the questions is based very closely on the report. The other 2 questions are slightly adjacent, shall I say. The first question, and these are questions put forward by our group, so they're not just from me. But anyway, the first question is, there's a growing concern that social care providers are unable to recruit and retain staff in Ealing. As paying conditions are a major factor, Ealing Council could be and should be reviewing the contracts of local social care providers to ensure that staff are paid at least the London living wage for this essential work, as well as perhaps helping employers to look at other incentives, help with housing, or at least housing advice, childcare arrangements, and the legal costs of visas for staff applying for jobs from abroad. So really, I think this was an issue that wasn't mentioned in Kerry's report. The whole care sector market and shortages within it. Our officers are aware of local shortages of staffing in daycare, residential care, or domiciliary care, and also confirm that they're assisting local employers to tackle these difficulties. That's the first question. Thank you.
Thank you. Shall I respond, Chair?
Yes, please, Kerry. Mine.
Thank you for the question, Roy. So the council, it's an interesting one because in Ealing we've got a dynamic domiciliary care sector, and we've got a large care home sector. So on one level, we're in a strong position in terms of staffing capacity and responsiveness to meet the needs of the community. But on the other hand, we're very conscious that Brexit, the pandemic, pay rates for staff within the sector will have impacts. So we're working very closely with the sector to keep a close eye on what's happening there. As we've discussed before, Roy, the council's working very actively around the London living wage and the ethical care charter, and we're actively engaged in developing plans around what that would look like, what the potential cost would be to the council. It is a challenging time. I think you're absolutely right to raise it. At this stage, we're not experiencing any issues, but that doesn't mean that in the near future we won't be. So it's something that I'll keep the committee informed of in future meetings should concerns be raised.
Okay, thank you. I think that's a good answer to the question, but I do feel that we are having reports from care providers who are saying they are having difficulties, having nobody respond to adverts, and nobody turning up for interviews when they're looking for staff, and also staff leaving to go and work for big supermarkets who are offering bonuses on starting work.
Yeah, I think I don't question that, Roy. We're not hearing it from a commissioning perspective at this stage. We do know that with the employment sector that there's likely to be greater levels of unemployment, and that can often benefit the care sector with people coming into the sector where they haven't previously considered it. And also the work that we're doing around London living wage, we think will support recruitment into the sector.
Okay, thanks a lot. I'd like to hear when the deadlines for these reviews of the contracts in terms of the London living wage. When those that information will be available, hopefully we'll hear that at a future committee.
Absolutely. I'll share that with you, with the committee, as soon as that's available.
Thanks a lot. Shall I go on to the second question?
Yes, please, Roy, feel free to.
Okay, thank you. The regular reports in the media and national press and television about dramatic increases in social care charging by local authorities. Healing Reclaim Social Care Action Group believes that social care charges should be scrapped for domiciliary care, and that any increases in these charges are unfair and discriminatory. Can the scrutiny panel commission an analysis of the costs and benefits of these domiciliary care charges to find out if the system should be changed in any way? I suppose that's a question for you, Daniel, as well as for Kerry.
Yeah, well, I think it is a question for me. And if I'm not mistaken, you've asked a variant of this question before. So I've told you previously that the commissioning of work like that would be the preserve of the cabinet. I'm happy to make the request again to the relevant portfolio holder. But at this point, we're going to follow the scrutiny process as laid out by Kerry and his team, which is looking at the quality of our social care sector, the performance of our social care sector, and then we'll make recommendations based on that. And I think one of the advantages of doing it this way is allowing groups like yourselves, the care sector as a whole, to participate in that, and for then Kerry and his officers to put forward their views based on what is happening at the moment. That, of course, doesn't prevent our officer team giving the council's cabinet different information in private, which has to be the preserve of local government. But I have made a commitment to you previously that whilst I've been chair, that we will have a strong social care focus to our research and to our scrutiny, particularly this year, and I'm intending to try and keep that. Kerry's got his hand up, so I wasn't expecting him to want to contribute to this particular one, but Kerry, go ahead.
Just to say, Chair, it may be, I see that the vote's gone through. I think that was since we've been speaking in this meeting at a national government level with regard to the additional funding for the NHS and social care, and there are significant charging changes to that. Once we're clear on the impacts of those changes, maybe it's something that I could bring back to the board with Cabinet's agreement. I assume Cabinet would want briefing on that as well.
That strikes me as a sensible way forward. I think we would all have concerns about the impact of what is proposed and what is likely to come in. So some extra information around how that's likely to impact in Ealing would be really helpful when it can be produced. And I'm sure Roy would welcome the opportunity for his group to participate in that discussion as well. So if you want to ask your third question, Roy.
Yeah, thank you. Clearly the national position is changing, so obviously we will have to react to that as that comes forward and we learn more about how the changes announced today will impact on the sector. But I think charging is an important issue for carers and for service users. And, I think it does affect the morale of those groups. And that's why I asked this question, which I realize I have asked before. But anyway, I'll move on to the third question, which is relatively short. The daycare provision in Ealing has been further diminished by the continued closure of the council-run Cowgate and Michael Flanders centres. The daycare sector is trying to recover, obviously, with council assistance from the long closures due to lockdowns and the pandemic. Can officers inform the panel and the public in Ealing what is causing the delays in reopening these centres, which have been closed for over 3 months, and I think probably more like 6 months? What is a realistic timetable for reopening? And can we have some details of that? Thank you.
Thank you. Shall I respond, Chair?
Yes, please. Yeah.
Thank you. So thank you for the question, Roy. So the two day centres that Roy's referring to, Cowgate Day Centre is a day centre for people with learning disabilities and significant other needs. And the Michael Flanders Centre is a day centre for people with dementia-type illnesses. Both services have been closed through the duration of the pandemic. Initially, the services were closed due to the high vulnerability levels of the people using those services. The people attending the Michael Flanders Centre were generally elderly and therefore at higher risk from COVID, and the people attending Cowgate, we know that the people with learning disabilities have been disproportionately impacted by COVID-19. So there's strong considered reasoning why the centres were closed initially. The Michael Flanders Centre has been turned over to a testing site, providing support to the communities in Acton. We've kept an outreach service to support the people who previously used the Michael Flanders Centre, and will continue to support those individuals in their own homes and providing as much support as possible. We've put the wider council on notice that we'd like to reopen Michael Flanders when there's an opportunity and an alternative site for the testing activity to be moved elsewhere, and we're working closely with our partners within the council to look at how that can be developed. The Cowgate Day Centre was due to be reopened in, I think it was June. However, there's significant building works that have been required to do in terms of the pipe work and Legionella risk within the site. We hope that will be done. We had hoped it would be done by the start of September. But unfortunately there's been some delays in the work, and hopefully it should be reopening towards the end of September, early October. Again, with the Cowgate customers, we've been keeping in regular contact with the people who use the services and their families. Just to say, Chair, completely agree with Roy that the day services are a key part of how we support the community, and we want to open them up in a safe manner as soon as possible, and we're working to do so.
Okay, thank you very much. Thank you, Roy, for your questions and your contributions this evening. They're greatly appreciated.
Thank you. Thank you.
Thank you. So Roy's slightly stolen my thunder, and so has Kerry, in regards to my summing up of this item, which was simply going to centre around the fact that we heard already from the previous reports about the impact on social care that the pandemic has had, and we know that to be true. And we also know that there are going to be a lot more people requiring this sort of care going forward. It's going to be one of the real challenges of the next 5, 10, 20 years, I think, given the greying population and the propensity for people to live longer with more challenging conditions, and the fact that, you know, we have a stated objective, and it is stated national policy that we want to try and ensure that people can live independent lives as much as possible in their own homes or closely into communities. So as I said to Roy, you know, I would like to keep the commitment that we keep this under review. I would like to go as far as to say that we should commission further reports from Kerry and his team around the progress in this area, so to look at some sort of mapping, that's probably not the right term, but mapping or planning, and what we're doing to deal with the problems or the need for these services, and that may well include things like what those services look like, who's going to pay for them, and what our own contribution to that financial cost is going to be, particularly within a challenging financial envelope for the council. So I've said this all to Kerry before, privately, so it's not going to come as a complete surprise to him, but I wanted to say that we would like to keep that on the agenda of this panel, and if there's an opportunity to work with Ealing community partners in some way as they shape their services going forward. I would like to do that as well, but it's clearly a longer term objective than just saying, you know, give us 2 or 3 reports to the end of the year and we'll stick them in a drawer somewhere. You know, this is something that's going to need regular review. So that's what I propose. And obviously anyone who wants to feed into that, please do give us an email. And we can shape those. But I've spoken about it with Councillor Conti in our pre-meetings, and that's the direction of travel we're going to take in this area. So that being said, I'd like to thank everyone for their contributions on this topic tonight. I'm going to move to the Health Watch patient experience reports, quarter 1. It's mainly for information, but Matt, you're with us. Is there anything you'd like to say in terms of introducing your report or picking out anything that's particularly relevant?
Thank you very much, Chair. I did do a 2-page summary of the report. So if I just race through that briefly, I'll assume that everybody's had a browse of the report, and I'm happy to go into more detail if any questions need it. So if I just share my screen with you all. Is that visible? Yeah.
Sorry, I'm on mute, but it is.
No problem. So between the start of April and the end of June, we received 1,211 patient experience reviews. Approximately 2/3 of these reviews were positive in sentiment for all of the service categories. And amongst these service categories, we received 299 reviews for GP surgeries, 401 for hospitals, 248 for dentists, and 161 for COVID vaccination centres. For GP services in particular, treatment and care was 14 out of the 20 instances in which quality was referenced was positive in sentiment. In addition to this, 30 out of the 40 instances where the suitability of provider was referenced, so the GP surgery itself was positive in sentiment as well. So this is really positive. Unfortunately, the negative theme for staff still continues. So 35 out of 103 individuals were positive about customer service at their GP. However, 62%, so 28 out of 45 individuals were complimentary about the suitability of staff who assisted them. Again, for administration and access, we see the same trend pop up in that only 31% of individuals were satisfied with appointment availability. 12 out of 31 individuals were happy with the experience of booking their appointment, and only 39% of people were satisfied with the waiting times for their appointment. So these 2 themes continue to persist, the staff and administration and access, and I'll move on to what we're doing about that in the recommendations section. For Ealing Hospital, the reviews are much more positive. So 84% of people were happy with their overall experience at Ealing Hospital, and 96% of people who reference the quality of care were positive in sentiment, and this included treatment. Staff at Ealing Hospital, 75 out of 79 individuals praised the customer service, highlighting compassion, level of attentiveness, and also professionalism by members of staff. And 92% of individuals were happy with the suitability of their member of staff that supported them. For other services, dentists and pharmacies received similar positive responses. However, for dental services, this does just provide an indication of the experiences of those who were able to access dental services during this time. We're still receiving continuous complaints and queries about accessing dental care in Ealing, So this doesn't represent the whole picture. For these reviews, individuals highlighted members of staff professionalism as particularly positive, as well as the efficiency of service as well, and the suitability of their provider. One area which I particularly wanted to highlight was the COVID-19 vaccination centres. So 93% of the reviews we received for vaccination centres were positive in sentiment, with residents highlighting compassion and patience shown by members of staff, the quality of care from the centres themselves, and how well the whole process was explained to them. We received over and above a 300% increase in the number of reviews we received for COVID vaccination centres, and the positive sentiment only dropped off by 5%. So this clearly indicates the consistent efforts that people are putting in at these vaccination centres is being represented in patient feedback as well. The next steps that we have taken to date based on the findings of this report is continuing to grow our online presence. So this is through social media, as well as regular webinars as well, with our latest being on cancer screening awareness. We've maintained our stepped approach to increasing face-to-face engagement with volunteers and interns, now supporting our face-to-face visits to GP services. This work is allowing us to work towards improving representation within the report. So this includes small surgeries, as well as a diverse range of ethnicities, age groups, and areas of residence. And we've also met with the patient experience managers at the London North West Trust to speak to them about how, not only how our recommendations can be channeled through their governance structure, but also how our patient experience team can start to visit the hospital again to gain feedback in that way. Finally, the recommendations based on these findings very much down to us, really. So it's to continue to increase our face-to-face engagement and improve the demographic. We're not only underrepresenting some key groups, but we often see that people aren't providing us with demographic information, which is obviously incredibly useful. So that will increase with face-to-face engagement. We'll identify key areas for concern for different ethnicities, and this will be produced in a separate report, looking across a specific period of time during the pandemic. We'll also work with all of you to identify any changes that are being made to primary and secondary care services during this recovery phase, so that we're providing patients with the most up-to-date information. And then lastly, we'll gather more reviews for mental health services, and we're doing this through a much shorter survey that we'll be able to distribute to patients and service users to get their feedback on mental health support services. The last thing that I did want to mention, GP staff concerns and administration concerns. And this is that we're going to look into the historical data to understand whether these issues have been persistent just across the pandemic, so largely a result of the pandemic, or whether they've occurred before the pandemic as well. If this historical data indicates that these issues are slightly more in-depth than just the pandemic factors, then we'll start to look at how we can hopefully support specific GP surgeries and PCNs as well. And if there are any questions, please let me know.
Okay, thank you, Matt. I have just two observations, if you don't mind. I'm going to use Chair's prerogative and go first this time. First is, I was quite sceptical about Healthwatch when it was set up, and about how vigorously it would be able to pursue complaints and issues. And I think these surveys show that it's created a real niche for itself, and it's being really successful. So, you know, I'd like to congratulate you all on your hard work to get to this point. And the second thing is just in your summary there, it was a combination of percentages and an indication of some of the raw data, i.e. the numbers of how many people had responded and who had said what. It would just be useful if we could have the raw data breakdown in some way, maybe as an appendix to the information you put forward for us, just then, because it gives us absolute clarity over how many people have responded and how many people are saying exactly X, Y, or Z. That's not to say that it's not an informative report. It's just a way that it could be improved. Now I've got a forest of hands. So I'm going to start with Councillor Dinser, and if everyone else can keep their hands up while Councillor Dinser is asking his question or questions, I'd appreciate it. Councillor Dinser.
Okay, thank you, Chair. Thank you very much. First of all, let me start with the confession. I have glanced through the report, so I haven't read it word for word. So if I do get anything wrong, I hope you will understand. I regularly appear on phone-in radio program. And one of the concerns I get is about the GP surgery, people having difficulty getting through and getting appointments. That is one of the biggest issues. And even on this report, you know, if you're looking at slide 12, I think the negative patient experience with the GP services is about 36%. If I'm not wrong, that's 1 in 3. People who don't come out with a pleasant experience. And the other issues which are mentioned in there, apart from the appointments, is the attitude of the staff and their suitability. And I think, and forgive me for this, but I think the report is trying to put a positive spin in what, in my view, is this service is the foundation of health in this country. And if 36% of the people, when they contact their GP, they haven't got a pleasant experience, then something we need to look at. I wanted to say quite a lot, but I'm restricted with my IT skills because I can't see the report at the same time I'm talking to you, which is normally, we can do that in a physical environment. And I think the recommendations which are made, the recommendation do not, and the action point, I think they do not respond to the findings. All they are trying to do is just saying that we are going to continue doing this. What they say, we are going to have online presence. We are going to have face-to-face engagement. But that doesn't result, that doesn't answer the 36% negative experience where people are saying staff's attitude is wrong. They are saying staff's suitability is wrong. We can't get the appointments. So I don't know where that comes in the action points. I know you said you will speak to the experienced managers, but I think we need to speak to the practice owners, the people who are providing the service. Why do people have difficulty in their hour of need getting access to the service? I think the staff and the doctors in some cases, they act as a security guard. They can either let you into the system or they can keep you out. So if you pick up the phone, the receptionist is there, they can let you in, or they can say, we haven't got no appointments, go tomorrow. They don't care most of the time whether you are in urgent need. And I think I'm going to give it a rest because normally I would have prepared some questions, but I think you get my drift. I think we need a little bit more. I think especially when I was looking at the GP practices table, some of the areas, their experience with certain areas, you know, when you go south, north, south hall or Greenford, you couldn't, some of the surgery, you couldn't even find anything positive. 4 out of 4 people have negative experience. So I think we need to work together with the GP practices and experience. Having said that, I know the health professionals are under a great deal of pressures and they are doing their best. And I think most of us will think twice saying anything negative about the GP or the doctors, but that sincerity shouldn't be taken for granted, because when people don't get appointment, I no matter what you say, that's not good enough. Sorry. Thank you.
That's okay, Councillor Dent. So may I say, I never fail to catch your drift. You're always very clear with me. I'll just say a couple of things. Firstly, I think Matt's recommendations that you just referenced were recommendations for Health Watch as a result of what the report had indicated, and not necessarily recommendations for the GP practices or other parts of the NHS that were mentioned in the report. The next thing I'm going to say predates you coming back onto this committee, Councillor Dinser, but last year we did have a review into what's called the Ealing Standard, which looks at the contracts that the GP services have relatively recently signed and have been instructed to reach certain standards within Ealing that have been set by the local NHS. We did agree that we would take an update to that report after a period of time. I'll need to check what that period of time is, but I think given the nature of your comments and indeed the fact that this is a widespread problem, not just in Ealing, but everywhere in terms of GP services, it's probably well worth having a look at the progress of that contract and performance. So I'll certainly bring it up with our NHS colleagues, who I noticed their video is on
We're very short comeback
now, so that I might want to bring this up in our pre-meeting. Yeah, I'd like to come back to it at some point, but I do think as well it's important, as you recognised towards the end of your comments, the pressure that GP services and the health service in particular is under. But I have the same comments from residents in Acton with regards to the difficulty of getting to see a GP. It's not. I don't think it's a particular problem in parts of the borough. I think it's very widespread. Now, we seem to have sparked a lot of hands. I'm going to go, thank you, Councillor Dinser. I'm going to go straight to Dr. Taylor, because I thought he might want to come in. Yes, go ahead, VJ.
Thank you very much. Yeah, first of all, I just wanted to say, from a health perspective, we very much welcome the contributions that Health Watch make in terms of highlighting to us the information that they gather regarding patient experience. Well, I think that's really important to see what our patients are saying. Clearly, in terms of looking at the data and numbers around patient experience, particularly negative experience, one needs to be mindful that we need to drill down to exactly what that actually means in terms of negative experience that the individuals had with the practice. I've been hearing from multitude of practices up and down Ealing in terms of how busy general practice has been over the last 6 months, and every practice I've spoken to have said that they've been as busy as ever. And I think again is also need a greater understanding of what we define by trying to get a patient appointment, because as we went into the COVID pandemic, the modalities of access to primary care had changed, and in fact it was going to change in any case. The digital access and the digital solutions to primary care was going to happen, but it got accelerated by the COVID pandemic. And so access to primary care in terms of all modalities is greater than it's ever been. And what I'm referring to is online access through e-consults, the use of video consultation, and telephone. Quite rightly so, there are some issues around access, and one of the key issues is around the telephone systems that primary care uses. And we do know that there are differences between the telephone systems that practices use in terms of the ability for patients to be able to speak to their practice, particularly around the queuing system of telephone calls being dropped, having to wait a significant length of time. You know, part of that is related to, you know, the systems that practice may be using, which may be, some of them may be quite old and not up to the modern standards, but it's also down to the volume of calls coming into the practice, and clearly you need to have the workforce and the resources to be able to man the calls. You know, if you are getting you know hundreds of calls coming through to the practice at any given time, you need to be able to try and manage those calls. So quite rightly so, it is something that we want to try and look at and address across Northwest London. And in fact, we are having a primary care summit next Wednesday on the 15th of September, and we will be exploring with GP practices as well as our community services, mental health and social care, in terms of planning for winter, and also in terms of resilience and the future in terms of providing care for our patients in the community with respect to general practice and our community services. So we do appreciate that there are issues that we need to address going forward, but one needs to just be careful and mindful in terms of how we interpret some of this information and data, particularly in view of some of the low numbers of the feedback. So clearly that can, as you know, skew some of the information. And in fact, when we looked at, when we just recently, now and I looked at the NHS patient survey, it's actually saying a different picture in terms of the patient experience with their GP and their GP practice. And in fact, Ealing is above Northwest London in terms of what the NHS patient survey is saying in terms of the experiences of general practice. So, but nevertheless, you know, there is much more work to be done, but it's going to be a collective effort in terms of everyone needs to, you know, play their part in terms of the NHS as a resource and how we collectively use the NHS as a valuable commodity, and that we access the NHS when our needs are there to ensure that we are getting the right services that we deserve. Right.
Okay, thank you, Dr. Taylor. Councillor Dintzer, I can see you want to come back. I've got two other people indicating, then I'll come to you, if that's okay. So Councillor Conti was next, then I've got Piotr, then I'll go to Councillor Dintzer.
Thank you. Matthew, my question is really, you sort of touched on it about sort of demographic points, but a lot of the, when you flick through a lot of the charts at the back of the demographic data, a lot of it seems really one-sided. Like only 4% of the responses were from Northolt, Hanwell, Southall and Perivale, and 57%, I think it is, were from the centre of Ealing. Like 65% of the responses were from people over the age of 55, and 54 were from people who are white British. And that obviously isn't very representative of Ealing. And I understand obviously the limitations in terms of obviously the pandemic, etc., which have obviously made collecting the data more difficult. I know one of the key things you've mentioned is about going out to more face-to-face sort of engagement with people in practices and at other sites. Just looking at historic reports from Healthwatch, was it a better mix when you were doing face-to-face sort of surveying, is it, do you still find that those hard to reach groups, potentially with issues such as language, or were you able to get their opinions, or was it a similar makeup, maybe a bit better, but a similar makeup to previous Health Watch sort of surveys? I just thought it was quite striking, really, how sort of sort of Central Ealing white older people made up the vast majority of the responses.
Yeah, this, as you quite rightly say, this is one of the limitations, and this is why we're exercising caution when we're recommending actions to be taken. This is an area that I really want to work on personally as well. Although it was better pre-pandemic, it still wasn't where I would want it to be. And I think this is largely down to the fact that the target is quite high in terms of the number of reviews we need to receive each quarter. So the smaller surgeries are kind of replaced by the larger surgeries that will yield more results, and this obviously then pertains to a certain demographic. This is one of the areas that I hope improves as we move back to our face-to-face engagement, and it's our areas of focus. And whether this means that the numbers suffer slightly, I think it's important that we kind of get that feedback, because in order to make these, or to help make these changes that we want to make to GP surgeries in particular, that our reports continue to show, the evidence base needs to be there. So we need to have the data, and we need to have the quality of insight, as Vijay touched on earlier, as to what specific areas need to be improved. Because if we go to GP surgeries at this stage and say there's an issue with your staff and your access, that's not going to benefit anyone. So we completely understand that, and we do recognize these limitations, particularly around the demographic information. And that's an area that I'm hoping to improve as we move on.
Okay, thank you. I mean, I think it's also incumbent on all of us, if possible, to help promote Health Watch's work. We will all know residents groups, voluntary groups. We will all know parts of our ward where there are people who have, particularly those of us as councillors who have had residents who've raised concerns, and I've already put Matthew in touch with various elements of the council to help with promoting Health Watch's work. But if people have specific areas of interest or communities that would be willing to participate, I know Matthew would be very pleased to hear from you all. So don't be afraid or hesitate to get in touch. Right, I've got more hands, so I'm going to try and deal with them as best I can. This becoming a popular segment. Piotr is next.
Okay, thank you. I'll keep it brief. I appreciate Dr. Taylor's comments regarding some of the telephone systems and the age of them, and that they have different systems, different surgeries with different curing types, etc. But just if I can take off my ECN hat and put on my Ealing Community Transport hat, I must say that if there are standards that had to be that are going to be reported on regarding telephone systems, then I think it would be good to look at those and also look if there is any historic data, because we deal with all the surgeries, and to be honest, my personal understanding since I've been in the job for 2 years is that there has been a significant decline in terms of not being able to get through, in terms of being hung up on, in terms of bad experience from vulnerable people who are then relying on us to try and ring the surgery, because when we ask them to go back to the surgery and change something, they say, oh, I can't do that, I never get through, it's just a waste of time. So without pushing it too far, I think we need to get that evidence, and if there are standards, and if we can get call waiting times or drop times, I don't know if that's possible, but I think if it's available, I think it would be good to look at it.
Look, I don't know if it's possible at this point. What we can do is facilitate making some inquiries to find out what data is available, whether we can get a hold of it. and what we can do in terms of analysing it. And that's where your input and the input of other colleagues closely involved in this work would be really invaluable. So leave it with us. I will see what we can look at. We'll have to have a look at what data Health Watch has got as well in terms of this, and you'll see in the work programme that there's some more information to come from Health Watch that might inform some of this at our next meeting. So let's see what we can work on, and I can certainly work with colleagues in between the meetings to see to see what we can unearth. Sorry, Piotr, did you want to come back?
Yeah, no, I just wanted to finish by saying that the general feedback we get from all the surgeries, from the patients we take to the surgeries, is extremely positive. And this is the one negative aspect of the whole experience. And I'm not surprised that the general experience is rated very high.
I think that's a fair comment. I've experienced the frustration of trying to access certain things, or, getting called by people who are saying, I just can't get through. And, we know that that's going to be more difficult now than in the normal times, if I can phrase it that way. But, it's worth having a look at. And we're not trying to slam anybody here or make unnecessary criticism. We're hopefully trying to be constructive. On that note, I did say I'd give Councillor Dinter a second bite at the cherry. Councillor Dinter, are you ready?
Yeah, thank you, Chair. You are very generous. I wasn't going to come back. I came back because I saw that the two panelists are CCG governors. So I thought it will be a useful opportunity to say what I wanted to say. I want to start off with, I think Vijay Taylor, I think he was saying we need to be careful how we intercept the information. I get the coded language. I totally get it. I try to put it. I try to, put my thoughts of my personal experience as well. The phone call I get when I'm on the radio show, people explaining their difficulties. I think historically the CCG, I think they have not appreciated the demand in certain areas, whether the demand meets the supply. I think doctors are working very hard. Nobody is saying they're not. They're working very hard, but can they cope with the demand? That's one of the reasons. I think one of the key criteria needs to be is how many people call the surgery for appointments and how many people got it. That will tell you whether people are getting what they are phoning for, because I think those receptionists, they are trying to manage a very difficult situation. They haven't got the appointment, they are trying to fob people off. I think that's what's happening. I think CCG, like I said, historically, we are talking about before COVID as well. COVID has added to the problem. We were getting similar kind of experiences before COVID. And I think one of the reasons were that's why certain communities are suffering from health inequalities. They are not able to assess certain medical professionals. I think my passion is getting the better of me, so I'm going to kind of shut up. But I think you understand where I'm coming from, and I think we need CCG has a lot more to do in this area, trying to meet demand with supply. That's where I rest my case. And finally, why is the CCG telling some doctors not to tell the pensioners to buy medicine off the counter, Gaviscon, any other thing?
Oh yeah, I think we might.
60-year-old, people who should be getting free medicines anyway. Why are they being told to go to the pharmacist and pay for it when they're perfectly entitled to getting a prescription from their doctor? And doctors are sending them there because I'm told that is that directive from CCG.
So, Councillor Dinter, on the last point, if you can put that in writing for me, I will take it up. I absolutely have to do that. I've made a similar point over a long period of time historically with regards to supply and demand for services in Ealing. I think we all have. I do need to give our CCG and NHS colleagues the right of reply. I believe both of them would like to exercise it. Neha, you had your hand up first.
Thank you.
And then I'll come to Chris.
Thank you. I really do appreciate it. And I take very seriously everything that you've said, Councillor Dinsa. And we have been reflecting and having daily conversations about this within the CCG, but not only in Ealing, across the whole of North West London. And it's not just a North West London issue either. I think what we are all seeing is that all NHS services, all health services are really trying to recover from COVID. The sheer volume of activity coming through, because as you all know, during COVID, that patients weren't always coming forward, and they're now coming forward. And it's not just GP services, all services are seeing that effect. GP services in particular. So in Ealing, we have 73 GP practices. And that's why we created the Ealing Standard. And in there was a very big component of that was around improving access. And before COVID, you could see the improvement. Maybe this is quite a few years ago, but you would have remembered there were practices closing half a day. There were practices not open as many hours as some other practices. And we've changed all of that over the last few years. When COVID hit, when COVID struck, GPs did not close their doors for any other reason other than infection prevention control. That was the national guidance, but they very quickly adopted online technology, literally a transformation that would usually take around 5 years. They did within weeks, and they had no choice, and they had to adopt these new technologies very, very quickly, and they did. But not only that, they were working to establish COVID hubs, understand what the implication of COVID was, and put in mitigations for their own staff getting COVID and things like that. So it's been a long journey, and I have been to one of these committees before, and we've had this same conversation. In fact, I think it was when we were talking about a similar Health Watch report when this whole conversation came up last time. I'm happy to bring back the information on the Ealing Standard, but also other information that we've been looking at around access. And just to be clear, I'm not a GP, but I am very involved in making sure I am looking at all of the services, and I genuinely can see the volume of activity has significantly gone up. There are root cause issues, as Dr. Taylor said, such as telephone systems, such as staffing. And this is another thing that we've brought up in the past, is the workforce. There is a workforce crisis, whether we like it or not, and it's just got worse over pandemic. So these are all of the things that we are starting to look at, and we will continue to look at. I'm happy to bring a report back in the future.
Thank you, Neha. We may well take you up on that offer. Chris, you were next.
1 minute.
Hang on, Councillor Midder. I'll bring you in if I have time. I want to go to Dr. Hilton, and then I've got Alan, and then I'll see if I can come to you before we close. Okay?
Okay.
Thank you, Dr. Hilton.
Thank you. Thank you, Chair. I don't want to make a long point because Neha has said most of the things that I was going to say. I'm also not a provider of primary care, but I now have the role as the director of the Integrated Care Partnership in Ealing, and I wondered if it might be useful for this committee for us to explore at a future meeting an opportunity for us to share some of the data that we do see. I know that our practices are now attending oversight meetings with the ICS, and there's a lot of useful data that we'll discuss tabling at a future meeting, something that actually helps understand some of the facts around how busy the practices are and what quality work needs to
be. So I think that would be useful. I don't want to skip entirely to the work programme, but we do have some space in the January meeting where I think, and that would give you enough time, give us enough time to scope a report around some of these issues, sort of a combination of a progress report on the Ealing standard, like Neha was perhaps suggesting. I don't want to put words in her mouth here, and then some of the information that you were talking about, Chris, could feed into that as well. But if we look at January rather than November, it gives us time to bring some of that information together, and also for colleagues to contribute to what they may want to see. Right, I've got Alan Cook and I've got Councillor Midder, and then I'm going to draw this section to a close because I wasn't expecting it to be our most contributory part of the evening. Alan.
Yeah, actually, it's not a question. It's actually answering some things that have actually been mentioned earlier. We had a discussion on Monday, the committee, Health Watch Committee, about going forward with our reports. One of the issues that was raised tonight was the fact that there were certain areas of Ealing which were answering questions where other areas weren't, and it's possibly due to people's access to electronic methods. And as we go forward, as we start to go back to the old system, more to the old system where people are face to face, you tend to be able to ask a few extra questions that help guide people. You're not supposed to be influencing them, but there are certain times when questions can be answered one way or another, and people say to you, well, what actually does the question mean? And you can explain it better, and therefore, once you explain it to people, you may get a slight difference in the way that they answer the question. And going forward, as we begin to start the face-to-face, we're going to have to be very careful how we balance between that which is face-to-face and that which is electronic. And that's basically what I wanted to say. Thank you.
Thanks, Alan. I'm going to go to Councillor Midder and then I'm going to move on.
Thank you, Daniel. I won't take time because Mr. Kamalji Dhinsa explained thoroughly everything. The thing is that the people as residents, they asking the doctor, they are making more patients. If he can't control why he's making more patients, they say the doctors are making money. I don't know this is true or false. I can say the other thing that when you see the doctor, if you talk to the doctor, hardly we get the appointment. He said, ask only one question, not the other questions. So why is like that? Because it take only 5 minutes. After 2-3 weeks, he get the appointment. If he asks the question, said, no, you can ask only one question. So please bring the improvement to the surgeries. The really people are suffering. They can't get the appointment because of sometimes the language problem. They go to the Indian doctors, so they take advantage. So please look in these things, will be appreciated. Thank you.
Let's try again. Sorry, I muted myself. Thank you, Councillor Midder. So I would defend our doctors against the first allegation that they're making lots of money out of patients. I don't think that's true, frankly. But I do think, there are clearly some issues in this area. And one of the things we said at the beginning of the year was that we'd be alive to problems that are specific to different parts of Ealing. And we're well aware of the issues faced in Southall and indeed in other parts of
Daniel, I'm not blaming the people, they are telling us.
No, I understand. Yeah, absolutely, Councillor Midder. Don't worry. I don't want to put words in your mouth. I'm making a general comment. I'm not trying to aim it at you. But what we did say was that we'd try and look, and indeed the council has a priority of trying to address some of these health inequalities, which is why it would be nice to hear from our cabinet members in due course on that point as well. But what I hear from the comments this evening and what we have as a tentative proposal is that we bring a report in January, potentially, to look at some of these issues and facilitate further conversation. I think that's very important with regards to what Dr. Taylor was saying, which is this data is a small sample size at the moment. We probably need contextually to have more information and a greater size of data in order to make stronger conclusions. But obviously the impact of services and the experience of local people is very important in that. So anything people can do to bolster Healthwatch's reach in terms of their future reports and also feed into our discussion for January would be really useful. So if colleagues have particular queries about particular instances or concerns from residents, do let us have them in advance. Right, I'm going to draw this bit to a close because we spent some time speaking about this, and we spent some time this evening already on our three substantive items. I do need to program before we finish. So in the November meeting, we'll be looking at adult social care. That's a combined response to the pandemic, lessons from the pandemic, a combined effort between Kerry, who's our Director of Adult Social Care, and Healthwatch, and potentially other colleagues as well. We'll have another update on COVID-19 from Anna and her team. And then there are two more Healthwatch reports centering around mental health and patient experience data, which I think will feed on from some of the discussions we've already had this evening. And as I mentioned, the January meeting has some gaps in it. So I'm proposing, and we'll deal with this through between the meetings. I'm proposing that we could draw up a report based on the discussions that we've just had for January, but there's still some gaps there. So we'll try and fill those items in. Sorry. Right, and Councillor Crawford would like to say something, so I'm going to cede my space.
Chair, this may not be appropriate, and I'm happy for you to consider it, and will not be surprised if it doesn't. It's not. I'm actually quite interested in knowing more, because we talked about the five values that we're looking at with our care homes, but there's something that's missing is sort of the experience of the resident. And I've been into quite a few care homes, and one recently quite a lot over the last 5 years, and I am really saddened that to say that the resident is often just left in a chair, and even whether they're in sort of in the social care or the nursing care, it's a real concern. So I would really be interested in having some oversight of what our care homes are offering in the way of amenity, getting out into a garden, access to a garden, what their activities are. Because from what I've seen, it's like a tick box, and a lot of residents, as they get older, well, they never wanted to join in a club in the first place, and missing, either in their room or it's not an activity. So I somewhere along the line, I would like to actually put myself in the place of family members who are choosing a care home in Ealing, and to have, and to check that, to have a check done that what is being advertised is actually there and it's on offer. Because we can see that the staff are so busy, they don't have time to do the one-to-one. So I would just like some sort of report at some stage. It doesn't have to be this year, but I would just like you to think about the possibility. Thank you very much.
Thank you. I think I'll have to draw on Kerry's expertise to see if it's. Oh, he's already writing. Right. So
No.
CQC have been discussing having a greater focus on people's experience as part of their inspection program. I can look at when this will be included in their program. Look, that'd be very useful, Kerry, and perhaps we can have a discussion in the next pre-meeting about how we might present that information, or how we can get some information Ealing specific, even if it's not a report that can be fed back to councillors. That'd be really useful. Right, I don't see anyone else wanting to talk about the work programme. If you do want to talk about the work programme, tell me now. Lovely, that's what I like to see. The next meeting, ladies and gentlemen, is going to be on the 3rd of November. I'd like to thank you for your participation this evening and for our discussions, and I look forward to seeing you then. Thank you very much, everybody, and thank you, Tamisha, for clerking the meeting.
Thank you, Daniel.
Thank you.
Very much.
Thanks, everyone.
Thank
Good
you.